Our lecture will be about schizophrenia form disorders. We also call it schizophrenia spectrum disorders or other psychotic disorders. As you see, so today we will talk about psychotic type of disorders. These disorders, means psychotic disorder, can be described with one word. So with this word is psychosis, and here is the definition of the psychosis. I mean, maybe it will be a bit generalized definition, but we call it loss of contact with the reality. If a person lost a contact with the reality, that means this person experiences psychosis. And another definition, during period of psychosis, people have a problem, actually cannot distinguish reality from the fantasy. And symptoms of psychosis include, you see, delusions, hallucinations, and incoherence or nonsense speech. So then they say something and you don't understand. Other people don't understand what they're talking about. So hallucinations, delusions, and disorganization. What does it mean? It's no contact with the reality. We already discussed that, but let's do it again. Hallucinations, obvious, yes. Hallucinations is just actually a part of internal dialogue, but person believe that these words, these imaginary, these fantasy, not belongs to him. Person starts to believe that it goes from outside, that it exists in the real world. So he cannot distinguish fantasy from the reality. That means he lost the contact with the reality. Delusions. Okay, a person believe, again, delusions is a false beliefs. Again, let's turn back. A person believe that somebody loves him very much. He absolutely sure in that. He insists on that. But the person who, usually it is a celebrity, who he claims as the lover, never contact with him, never know about him, and that's obvious for everybody, but not for this man or woman. They will insist, they will continue to try to prove you or for anybody else that yes, this celebrity loves me very much. They're absolutely sure in that. And nothing can destroy their strike belief. Nothing. Prove it. And they will give you proofs. They believe in these proofs. These proofs are really weak, actually about nothing. They not base it on anything, but they believe in that. And that's it. Okay, so incoherent speech means you don't understand what they're talking about. Later we will see that this is a derailment, so-called. Or then you ask something and the answer goes about something else and you don't understand what they're talking about. Derailment means traveling of the sentences. Like you read a book and you read one sentence from number 4 page, then next sentence you read from number 5, maybe number 20, 30, 35, etc. So that will be number of stories, but you don't understand the consequences, the connection between them. So this person not in a contact with you, with the others, with the reality also. He just somewhere in his own world. We call this psychosis. And in psychiatry, we used to have another division in the classification, or two main groups of the mental disorder. It's neurosis, psychosis and neurosis. As I said, psychosis is a moment when people lost the connection with the reality, the ability to tell the reality. In neurosis, people steal, people preserve these testing of reality. They in their contact with the reality. What happens with the people who got a neurosis? So they are in a distress, yes. They are some part of their personality is being affected by the disorder, like emotions. For example, they can have a lot of anxiety, but this anxiety not so powerful to lead for the great distortion of the reality or the perception of the reality. You see that people in neurosis, as everybody else in this world, can perceive the reality subjectively. We are, everyone, it's a feature of your personality to perceive everything personally, unique in your own manner. That depends from your experience, from your motivation, from your current physiological and emotional state. So depending on all these factors, we perceive the same things differently, as you remember. And people with neurosis, yes, they can perceive some distortions. There can be some distortions in their mind, in their perception, but not so intensive. Well, for example, a person with an anxiety, yes, we can, I can make you a picture of a student which is actually do not experience so much of anxiety. He do not afraid too much of the exams, and well, this person lives more happily than another student. And this student perceives the same things. He don't believe that the teacher gonna kill him or destroy him. But this patient, not patient, this student, I'm sorry for the second. So in neurosis, and this student with neurosis, he afraid very much of the same exam. He's been worrying. He afraid of a new acquaintance, for example. He do these acquaintances. He go and socialize, but usually a person with neurosis expects much more dangerous or much more problems from the future than relatively healthy people without neurosis. What also can be neurosis also accompanied with the symptoms of anxiety. Visceral symptoms. Visceral means internal symptoms like a headache, heart pain, chest pain in the chest, a feeling of problems with the breathing function. Sometimes they have problems with the intestine, like gastritis or something like that. So these are the without any obvious damage in these organs, but they feel the problems with the sensations, feel, as I said, the pain or uncomfortable feelings in the internal organ, in the internal, from the internal sphere. Or they can have just phobias. And of course, a neurosis that does not result in disturbances of using of language. Thinking. That's language, it's our thinking. It's just a demonstration of our thinking. And of course, these people have no problems with the thinking. They can maybe have problems with attention, with the productivity of the thinking, but not with the content, not with the logical connection between the events in the reality. And now let's go to the particular disorders. Start from brief psychotic disorder. Brief psychotic disorder. Pay attention for the name. For the name. Brief means 1 month, no more. 1 month, no more, and it's better without treatment. These, why without treatment? It's better for this disorder would pass without treatment. If it will be longer, than 1 month, so that will be no more a brief psychotic disorder. That most probably will be a schizophrenia. What happens with them? As you see, it has a sudden onset. Sudden means during approximately 2 weeks, maybe a few days, 2 weeks, but no more than 2 weeks. So, okay, maybe a bit more than 2 weeks, but it means sudden. Why is it sudden? 2 weeks, not so sudden beginning of the disorder. But actually, schizophrenia, as in contrast from brief psychotic disorder, so schizophrenia develops during half of a year. Not the symptoms of the schizophrenia, mostly, at least not the main symptoms present over here. So in this prodrome period of schizophrenia, there are a number of problems occur in the life of a patient. He starts to experience some problems in the concentration, and emotionally he feels himself uncomfortable, maybe too anxious a bit. He lost the interest. He very easily become fatigued. He preferred to run out, and of course, these people start to think too much, to think in a strange manner, to have strange ideas. So that's a prodrome period. As you see, these can be any kinds of disease, mental or any kinds of that, but this prodrome period is very long, quite long and quite visible in the schizophrenia. In brief psychotic disorder, these psychotic symptoms happens to be very instant and do not wait for development. Full return to the function, to the previous level of function. In schizophrenia, again in contrast, after we treat acute episode, it requires a long time and sometimes to get back to the previous level of functioning, and sometimes because negative symptoms occurred in the patient with schizophrenia, we cannot achieve the previous level of well-being. Now, there are some symptoms, some negative symptoms could stay for even maybe for all the life of the patient. Here we have a complete recovery. These are the official criteria for brief psychotic disorder: delusions, hallucinations, disorganized speech, and grossy behavior or catatonic behavior. Disorganized speech, understandable, yes. Derailment, you know what is that? Incoherence of the speech. Incoherence means that one association, one thought, one idea, if you wish, one sentence. Sometimes other people, you cannot see the connection between what patient says. He can say you one sentence and then quite absolutely unsuitable over here in this conversation, in this current story words, like I'm looking in my monitor. That's my phone ringing. And the sheep give a much more profit than to breed the cows. Incoherence between the association. Well, as you see, these symptoms must not be explained through the cultural response, cultural sanctioned response. What does it mean? That means, as I already gave you an example, for example, here in the funeral, women have to cry. Not only to cry, to scream, to produce such a loud moaning, so they have to show how they are upset, how they desperately upset. And then women do this in front of the, for example, enter to the flat where the recently died person lies, or sometimes when you're not familiar with this tradition, you think that we have to call somebody to help this lady, or we have to go to the pharmacy to hench to bring some sedative drugs for her. But actually, no, that's not necessary. She will control her behavior. That's a cultural thing. But behavior looks like grossly disorganized. The duration criteria, as I said, no more than 1 month, and full return to pre-morbid period. What else? The exclusion criteria of a brief psychotic disorder requires that this is not a depressive or maniac episode. Bipolar disorder can include depressive episode and maniac episode. It's not a schizophrenia or catatonia. It's not effects of the substances. In this case, we will have a brief psychotic episode. The treatment of brief psychotic episode, of course, same as schizophrenia, but not as long as schizophrenia, approximately 1-2 months after the symptoms gone, we can gradually decrease the amount of medicine, and then we can just cut it out. What happens, the subtypes, or maybe a few words about the etiology. Brief psychotic disorder can be a result of the severe stress. For example, a person works as an accountant, and instantly he discovers that in a budget of a company, I don't know, $1 million or 20 million sums are disappeared, and he don't know where, and he don't know why. This guy will be in a serious stress because he is responsible for this money, and in this case he can have a kind of delusional episode that he starts to think that they are spying on him. They put a hidden camera somewhere, and in order to find where I put the money, but I didn't do this, or it was made intentionally by my enemies. They just stolen this money in order for everybody would think that I did it. So they can be really guilty or not, but they can experience psychotic symptoms after these. We call it reactive psychosis. It can be without stressor, okay? That's the case, then we cannot see the direct connection, cannot see so intensive stress or something like that. And it can be with postpartum onset. In a postpartum period, that's a period that all the women are very vulnerable because there are dramatic changes in their life. So they give a birth, That's first of all great stress because it's painful. Second, it's a great stress, biological stress, which also will be consequently psychological as well. So all the hormones, a lot of parameters change dramatically into another amount, including hormones and including neurotransmitters. For example, great insufficiency of the serotonin will be, and consequently, not consequently, but it is very highly connected that the amount of dopamine can be very high. And this period, woman is very vulnerable to develop this kind of disorder, to lose control of the reality, because, well, she will be inflated with fear or with anger, or usually both together. She's so scared that she can lost the ability to test the reality as all the others. Delusional disorder. Well, delusional disorder, here we have one or more delusions in a person, usually one delusion, one delusional idea. Small remarks. What is delusional idea? As I hope you remember, false, unshakable belief. Unshakable, nothing can persuade a person, sorry, that he's right, that he's not right. Nothing can change his opinion. Also, you see that hallucinations not present, absent, actually, absent. There should not be any hallucinations, and if there are some of them, they are very small. They're not prominent, and actually they are just a continuation, slight continuation, slight appendix to the main topic of the delusion. We'll talk a bit later, but functioning. Functioning is well. Compare with schizophrenia. In schizophrenia, a person has delusion. Okay, he has hallucinations. Okay, maybe delusion will be dominated, but his behavior will be disorganized as his thinking. In delusional disorder, thinking is organized, thinking as well. The problem is with the content of his thinking. He's obviously good at work, everywhere, no problems, except those areas which involve his delusional idea. For example, if he got delusional infidelity, he's a very nice guy, but with everybody, but not with his wife. Other people believe that he is a very, very good person. But maybe something dangerous could happen with him, with the wife, and after that, wow, everybody's been surprised that he was normal. It's okay. How's that possible? But because of delusional disorder, people with delusional disorder control very well their behavior, and and they just believe in something. And, they don't want for other people to think that they are crazy. What can happen and what should be? So the problems, you see, goes from the delusional beliefs. For example, if a person, a man, afraid that his wife don't love him anymore, it's one case. He afraid, he doubt, and usually even he can't say nothing to the wife or to this lady, because he got a kind of an internal dialogues, torture, so he's not sure he's got normal feelings. But if person has a delusion, she is in affairs, that's it. It's already proven for him, so it will always lead to change his behavior towards his wife. That's a criteria, the presence of delusions more than 1 month, it can be shorter. If it is shorter, it's a brief psychotic disorder. I hope you remember. And criterion A for schizophrenia never been met. Below you can see what is in concern, what is the content of this criterion? Actually, it's a group of symptoms. As you see, delusions, hallucinations, disorganized speech, frequent derailment or incoherence of thinking, and grossly disorganized or catatonic behavior or negative symptoms. So actually, negative symptoms they are not named over here. So, no, not any of these symptoms we can find in patients with delusional disorder. And as you see, hallucinations. Hallucinations is just a continuation. In a previous lecture, I give an example that a person can believe that his neighbor tried to poison him, want to poison him, and he do this, he practice this. I mean, my neighbor somehow find a way how to found the entrance, no, to my to the tubes in my house with cold water. So my neighbor somehow invades over there, and he can add a poison for me, and he do it. And because sometimes I can feel the smell, the taste or smell, some strange smell in the water. Sometimes I feel it, sometimes not. Actually, then I believe that there is a poison. After I believe in that, I will be very, very suspicious to the water, and yes, now I can feel it. So that's not a hallucinations, for example, as they are not a fully developed hallucinations. No, that's just a servant of the delusions. Real hallucinations, and then person feel the snake of the feel the smell of the dead body around, because he also believes that he is dead now. That's about Capgras syndrome. It can develop in the depression. So depression, serious depression. He don't feel himself alive. Means in the beginning it's in terms of joy. I cannot feel joy. I'm not alive as I usually. And then depression goes down, and he feels really sad, and it can become so intensive, not with every patient, but very, very intensive. Then person start to believe that he dead, he already dead. He can feel the smell of the corpse, the smell of the dead body from him. So this is a hallucination. So hallucination in schizophrenia, then person can hear the voices when they talk about him. Here, there is no actually hallucinations, and remember. So, as I said, the behavior is remarkably not impaired, and only manic and depressive episode, if they occur, they not develop, they connected with the symptoms of these patients. It's not because of the psychological effect, or not because of the medical procedures or medical complication of a drug or something like that. It's not a body dysmorphic disorder. Body dysmorphic disorder, then patients absolutely believe that he is ugly, or some part of his body is ugly, and he absolutely shows them. But these body dysmorphic disorders, actually, it's only about one part of the body, and usually this part is not so ideal, not so much, but people so much afraid of that they have no improper body, ugly body. So they so much worry about that, and they usually decrease the amount of socialization, etc. Obsessive compulsive disorder, well, obsession is a strange idea, but in obsessive compulsive disorder, people usually find their obsessions or their strange thoughts as strange, as embarrassing, as something which is stupid and unnecessary, but they can do anything with these delusions, with these obsessions. In delusions, of course, people do not fight with their idea. Types of the delusions. Erotomanic type, you remember, yes? The famous Bollywood star loves me. Who are you? I'm just a man peasant from a very distant rural area. Why she's in love with you? Why don't she come in? She have to keep this in secret, etc., etc. That's why she cannot come. But okay, so show any messages. You know that messages also can harm her. So she just given me a hidden signal, like my name is I don't know, Chaudhary or Prakash, and the last film that she was starring in, also there was Prakash. That actually was about me, my relationship, and her. Of course, they needed to hire an actor for that, but that was a obvious and thick signal that she loves me because I am Prakash also. Grandiose type of delusions. It's I'm a god. I can heal the people. I can make them alive again, etc., etc. Jealous type, I describe you, and persecutory type. Patient think that other people have something against him. For example, when I pass the group of Indian students and they will talk in their own language, I can start to think now they planning to, I don't know, to destroy my lecture. Now they planning some kind of plot against me. Mhm. Somatic type people believe that they have a disorder, some kind of illness, serious illness usually, and they require serious treatment. But indeed, nothing more there. You can see that psychosis also can happen in mania and in delusions, but this is not a delusional disorder because it's just a direct consequences of their disturbed emotional condition in the patient. So if patient is being sad too much, he can develop depressive type of delusions. Like there will be an apocalypse very soon, or my family will be really poor and we will all die from the stomach. But nothing is can happen is but he predict a very bad future. He got depression, and after that he can have secondary delusional things. Well, schizoaffective disorder. Let's make a small pause, okay, for a few minutes, actually for 4 minutes, and then we will continue. Okay. Sorry, let's continue. Where are we? Schizoaffective disorder. Well, it can be, from one hand, in one hand, it can be difficult to understand, but it's a very simple type of disorder. This is a short explanation of the major things in the schizoaffective disorder. And as you see from the name, it's a combination of schizophrenic disorder, and affective disorder. Affective disorder, we have a lot of them, but the main affective disorder, of course, it's a depression or mania, or bipolar disorder. So here we have then they occur together all the time. Then a patient has a relapse. We can find two types of symptoms: schizophrenic symptoms and symptoms of depression or symptoms of mania. They go together. And first. Second things is that the schizophrenia symptoms, they must be or as long, must exist, must be present as long as it necessary, as well as symptoms of mood disorders or affective disorders, or schizophrenia symptoms must present, usually they present longer than the symptoms, than the affective symptoms. Why? Because otherwise, if the affective symptoms would be longer, yes, would begin, and only after that the symptoms which remind schizophrenic symptoms, and they are delusion and hallucinations, would occur. So in this case, we can say, usually we can say, and it is first of all, it's a affective disorder, mania or depression, with so-called psychotic symptoms. So it's just serious and with the complications, but mood disorder. This is a mood disorder with complications. But then we have a case, then we have a delusions and hallucinations in the beginning, few weeks maybe, then together or at the same time or after a bit, 2 weeks, we also can see an inclusion, addition of the, for example, depression or mania, very active behavior. In this case, we say it's a schizoaffective behavior. So symptoms of schizophrenia, in terms of delusion, in terms of hallucinations, will occur earlier than depressive episode or manic episode. You see, the mood episode must be present at least in a half cases. So if they present less, not so often, so this is a schizophrenia, actually. Schizophrenia, unfortunately, combined with affective disorder. But that's two different disorders. And very, very common understanding, a very common stereotype, but that's not only the stereotype, that schizoaffective disorder have much better prognosis than schizophrenia. Why we cannot use these? It's not a diagnostic criteria. It's, let's say, so additional, maybe a bit helpful criteria, but that cannot be a direct reason to put diagnosis of schizoaffective disorder if we have a patient with with the symptoms, and if this patient is relatively in good social and psychological level of functioning. Okay, this is not a reason to put, because not a reason to put only schizoaffective disorder. This guy also can have a schizophrenia, but with good prognosis, with good course of this disorder. So he time after time have a relapses of schizophrenia, and he has developed negative symptoms or too much of negative symptoms. So that could be that's not a positive, a benign or mild form of schizophrenia. But let's go to the criteria of schizoaffective disorder. Uninterrupted period of illness in which we have combination schizophrenia or mania or depression. So it have to be a depressive mood if it is depression. Delusions or hallucinations we observe for 2 weeks, maybe more, in the absence of depression or mania, something like that. Symptoms that meet criteria for major mood episodes present for majority of the cases. As we said, but because if we have a case of schizophrenic relapse, but there is no symptoms of mania or depression, so this is a schizophrenia. So that's not because of, it's not because of abuse of drugs, not because of medical, not because of some kind of substances, drugs or something like that. And we have bipolar time and depressive time. Well, before we move further, a few words. That's today we will have a shorter session. Due to Leonhardt theory of viewing of the nature of the mental disorders. So Leonhardt, it's a German psychiatrist. He was working in the end of 19th century, in the beginning of 20th century. So he said that all the mental disorder we can put on a line between schizophrenia and affective disorder. So if person has an affective disorder like depression or mania or bipolar disorder, so the outcome of his disorders would be good, would be relatively positive, will be relatively, well, safe. But if he has a schizophrenia, so that means his condition will be worsening and he will end up with crampy condition. He will be a person with disabilities. That's it. So schizophrenia is a progressive worsening condition with bad prognosis. Bipolar or affective disorders, they have a good prognosis, and all the other disorders can be in the middle. So schizoaffective disorder, it's in the middle. That's why it have a relatively better outcome than schizophrenia. That's again about the nature of this disorder. And last what's left, so psychotic disorder due to another medical condition. We put this diagnosis if we see that psychosis is a consequence of general medical condition. Or another, or some kind of medical disorder, well, somatic disorder like hypertension, brain hemorrhage, I don't know what can it be, hormonal disturbances, something like that. Of course, we have to have physiological proofs that something is wrong with him. Some tests, some blood tests, some tomography or something like that. So yes, that explains. And symptoms present not only in a context of delirium. So this is not a delirium. In delirium, of course, we will have psychotic symptoms like delusions, hallucinations, disorganizations, disorientation, suppressed conscience, restricted conscience, problems with an attention, cognitive function, something like that. But delirium, this is, as you see, it's an acute condition, an acute complication of the subedema of the brain. Then we have an electric disturbances, electrolyte. The disturbances, poor oxygenation, usually acidosis. So in this case, of course, a person will have psychotic symptoms. But this is a delirium. The delirium that's a direct, visible, obvious damage for the brain. Delirium is a result of it, is a consequences of it. Now, for what kind of psychotic disorder due to another medical condition? Neoplasms, yes. Of course, then we have a then a patient has a metastatic tumors, yes. Neurovascular events, yes. So there can be delusions, seizures, or something else. In the seizures in a temporal area, very often leads to the olfactory hallucinations, because these temporal area are responsible for the detection of smell, and also this area is responsible for religious experiences. So sometimes epilepsy, temporal epilepsy, is very often combined with religious insights, with just sparkle, flash of understanding of the God will, or kind of excitement about that. Like, I'm a prophet, I can see what God wants, what God needs. And these people very often go to becoming religious leaders or advisors or counselors. Sometimes they believe that they are prophets. That can be because of the seizures equivalent. There is no seizures, but instead of that, instead of seizure, people experience these feelings. That's because of the temporal lobe damages. Well, of course, psychotic disorders can be in a hypothyroid, Addison's disease, hypoparathyroidism. So hypo problems with the endocrine system, with the hormones, can very often lead to the psychotic symptoms. Neurodegenerative disorder like dementia, Huntington disease. In a Huntington disease, it's a dementia type of dementia, but very often in this type of dementia, maybe if it will be a fast symptoms, person experience behavioral problem, demonstrate the behavioral problem. What kind of the he can be aggressive, irritated, sometimes he can get delusions, hallucinations, or threatening nature. They threat him, they tell him awful things. So these people very often develop as well as the Creutzfeldt-Jacobs. But in this Creutzfeldt-Jacobs disease, they not so intensive, I mean, these behavioral changes. But in Huntington, that's very intensive. White matter disease, I don't even read them. So in white matter diseases, yes, there can be, of course, there can be psychotic symptoms. And systemic lupus erythematosus also can give a result of that. Well, other psychotic disorder because of substance or medications, because of using of medication. Very obviously, amphetamines, cocaine, phenylcyclidine, These are the drugs which are from the group of stimulants, and they make person to hallucinate very often. Hallucinogens, it's a particular group of drugs like LSD or lysergic acid, D-ethylamide, mescaline, psilocybin. All these drugs can cause, of course, the hallucinations. They sometimes they elicit from the mushrooms, but they dangerous with hallucinations. Well, cannabis and all other things also can cause psychotic experiences. In cannabis intoxication, people can become very, very suspicious till the delusions that he's going to kill me, their own friends, his own company with whom he just had smoked. Now he perceived them as those who's going to kill him. I think this guy with such type of pathological cannabis intoxication, I don't know what is normal, unfortunately, intoxication. So in these intoxication, this person can be really dangerous for the society. Okay, so looks like, yes, that's finished for today. As I promised, it will be